My name is Rose Dyson. Since I was a small kid, I knew I wanted to work with horses. So I did a special education to become a horse rider and trainer, and at this moment I work full-time as a horse riding instructor. A couple years ago I followed another education to specialize myself in the rider's seat and balance. Looking back at the two educations afterwards, I think that actually the order of the educations was wrong, because what I learned at the last education about the rider's seat should actually be the first lesson of everything. In this video I'm going to work with Marleen Notenboom and her Grand Prix horse What Now. Let's see what happens if I teach this very first lesson to this Grand Prix rider with her Grand Prix horse. I have never worked with Marleen before, so I start with an analysis and I make some notes. Now we start working on the movements of the rider and the way she uses her body. In this lesson, we worked on a couple things. At first, we worked at the position of Marleen's ribcage on top of her pelvis. When the ribcage is right on top of the pelvis, there is more relaxation of the muscles possible because there is more balance. Think of a pile of bricks. They don't need muscles to stay in line. But if you tilt one of the bricks, they will all fall down. Also, it is easier for Marleen to follow the forward movements of the horse when her back is straight. With these improvements from Marleen, you can see that the horse starts moving with more suppleness because it's easier for him to use its stop line correct. Also, the connection with the mouth becomes smoother. Marleen can use lighter aids now because the horse has more throughness in its body and can now feel her seat aids better. The bigger aids from the reins and legs aren't necessary anymore. If you want to be a good trainer of your horse, it's important that you have control of your own body and that your body is working well. There are so many types of bridles, bits, saddles, spurs and other training tools, but at the end it's your own body that is the most important piece of equipment to train your horse. To find out about how Marleen's body is working, we are going to Ilse Stuits, who is a physiotherapist and a horse trainer. Ilse is going to make an echo from the back and stomach muscles of Marleen. On the echo, we look at the muscles which keep the balance of the body and the muscles which make the movements of the body. Sometimes the cooperation between those two types of muscles is not good, or sometimes there is a big difference in strength between left and right, or sometimes there is too much difference between the stomach and the back muscles. These are all things that influence your riding, but that can be improved by training. After the echo, Marleen does a functional movement screen. The name speaks for itself. We have a couple of exercises to test all her joints on mobility and stability. Also, we look for similarity between left and right. The functional movement screen will be used to decide which exercises will go into Marleen's individual training program. All the exercises in this individual program have the purpose to make it easier for Marleen to sit correct, and therefore Marleen will become even a better rider. We also check if the pelvis is straight and if the weight is divided correctly between left and right. If not, the horse has a hard job in carrying the rider. For a rider, it's also important to have enough endurance. When you get tired, your coordination, your concentration, your balance, your strength, your suppleness will all become less.
I have a dream.
Horse riding is not as easy as it looks from the ground. Just to sit on your horse without disturbing its movements is a tough job. But when you manage to become a pleasant rider for your horse, it is the most fascinating sport on earth.